Welcome to the Osteopathy and Healing Center. Today we're going to be looking at Infantile Postural Asymmetry, IPA for short. So here we have Joanna, and as I'm going to talk, we're going to try to have her rotate her head to both sides, to turn her head to see if she likes to prefer one movement to the other. So to do that, you could tell she's already turning here to her left. And you could use a toy, or you could call her name, Joanna. And so you could see her range there. And you're also looking if the contralateral shoulder lifts as she turns. If it does, that would mean there's a restriction. Now, we're going to try to have her turn the other way. Joanna! Joanna! So this is passive, it's called. We do not put our hands on yet. We're just observing. Joanna, look at mommy. What's that? What's that? Hello. Hi, sweetheart. Hi. Hi. Yeah. Okay, and now that's her rotating to the right side. Again, you're checking if the contralateral shoulder lifts as she turns. It does not. Her range is actually pretty good. If I had to choose, I'd say as she turns here to the right, there's a little bit more restriction. Hi, sweetheart. Hi. Hi. Yeah. And, oh, actually, there you go. That's the full range. So she's good actually to the right. She's good here. Okay. And also, you're checking for any truncal convexity. So if, as she's turning, does her spine have a tendency to go side bend like this to one side or the other? And so we're looking at what's called structural IPA. There's also mechanical and neurological. And any issues with IPA, so any asymmetrical positioning within the infant, can have an effect on functional development. And Philippe in 2006 put these two movements, one cervical rotation, two truncal convexity, to see if there's any IPA within the baby. Okay, and this, if we do have a restriction, it can also have a subtle asymmetrical effect on the reflexes as well within the infant. And through the osteopathic concept, what we do know is if there's any IPA going on, it's going to affect it could affect the cognitive processes and also the development, and that could be through what's called proprioceptive mapping, respiratory-circulatory systems, and myofascial relationships, which we're going to explore later on, and also lastly, cognitive mapping could be all affected by IPA. So all this information I'm getting is from this book, Pediatric Manual Medicine. And the next video, we're going to actually put our hands onto the baby and check if there's any active restriction at each level. But this is just strictly observational. And if the infant is more than 4 weeks old, we could also put them onto their belly and check for the same thing. So we're gonna put her onto her belly. Okay, and then again, we're checking if the baby's able to turn. Joanna, good. And the other way. Joanna, look at me here, baby. Look at me here, baby girl. What's this? What's this? What's this, Sophie? So, if we find restriction when they're prone like this, that means there's a problem from C3 to C7. Joanna, look at the baby. Look at the rabbit. And when they're supine or on their backs and we find a restriction, what's that? Yeah. So here to the left, just have a little bit of restriction we're seeing. So any level from C3 to C7 could be affected. And when they're supine, it would be C1 or the atlantoaxial joint that could be restrictive, preventing the rotation of the neck. So there you have it. Thanks for joining.